Okay, everyone. So this is going to be my video on my mom's Lynparza regimen. I'm going to talk about what she's doing right now and then also go into how we modify it over time. So I'll show you everything that she's taking and some of the adjustments that we're going to make. We just do this periodically. I want to say I wish it was every 3 months, but we really just do it when we feel like we need it. We're kind of at that point where we're feeling kind of stagnant. So today was a day for us to go through everything and see what changes, see what we needed to mix up. So this is my desk area. Don't judge me. I don't dust as often as I should probably, but we'll go through each of these. There's my pile of books that I try to keep out of the way. But yeah, this is everything that she's taking, and then we'll talk about, again, what she's going to take once she runs out. We don't put too much stock into what keeping things even. So essentially when she runs out of this, then switch to the next thing. So we're not too regimented in that regard, but we do try and be organized in the way we do that. So I'm going to switch angles and let's get started. Okay, so this is going to be essentially the list of things that my mom takes. She does list them alphabetically. And then we'll go through, you can see some of my handwritten notes in there as she and I talked about what the different doses were going to be and what that was going to look like, again, as we go through. I did add in some notes here too, so I'm trying not to get you too dizzy on this, but essentially what this is trying to achieve is immune system maintenance. We want to mitigate the effects of Lynparza without reducing the efficacy. We want to fight and kill stem cells and circulating tumor cells. She does 5 days on, 2 days off. So a lot of and that's primarily for the anti-parasitic. So she'll do a reduced protocol on the weekends. What we want to do is mitigate or at least reduce some of the toxicity from some of the anti-parasitics. So we're trying to keep the doses relatively stable and or low. So you'll see that when we start talking about, she's on L-bendazole right now. But some of these antifungals can be toxic over time, of which when you add more toxicity, that's more load on the body, more stress, more inflammation, more bad things. So given that she's still cancer-free, we are assuming that most of the cancer is gone, and we're trying to essentially mop up anything that's remaining. Inspiration from this comes from Mark Lintern's Cancer Resolution, Reimagining Cancer Through Another Lens, with some, let's say, a flavor of Jane McClellan's How to Starve Cancer, and some Dr. Paul Merrick's Cancer Care. So those three are the primary go-tos for me as far as how do I devise a protocol, what am I trying to achieve, and what are some things that I can do to achieve those. Not everyone's going to have exactly these goals that I've stated. So essentially, what are some of the goals that you can look for, and what are some of the things you can do for that? And those 3 books are essentially my primary sources. I'd say honorable mention goes to Nasha Winters and the Metabolic Approach to Cancer. That's another good one if you're, in my opinion, if you're cancer-free and want to stay that way. I think that's worth looking at as well. Okay, so let's get started. So as far as you can see, so first off, let's see if this can, there we go, activated charcoal. So she does that on Sundays only. So essentially she'll use that to help clean out a bunch of, so that's a binder. So she'll take essentially 1 pill first thing Sunday morning, and she'll do her serapeptase. So these are her binders. So serapeptase is every day. So she'll take 2 in the morning. You want to do this on an empty stomach typically, and that really helps achieve the binding effect rather than it being simply a digestive enzyme. If you take it on a full stomach, it's not going to hurt anything, but you're just not necessarily going to get the effect that you want Oh, one more thing. Disclaimer, this is not medical advice. I'm not a doctor. I am a freelance cancer researcher, and this is what my mom does. And you're welcome to, and I want to share with you what she does. Please acknowledge that this is experimental and not backed by clinical trials. Okay, so albendazole. What I have found in the research, and this is from PubMed, is that there is very little to support taking albendazole for cancer. What I also have not seen is anything that would say it would be harmful. Our trouble with albendazole, or mebendazole, she does have a prescription for mebendazole. However, we can't get it. So she got it, or she goes through the military pharmacy because we're near a military installation. So we do use TRICARE. And so she had it initially off post, and she would get it, 8-day supply, 2-day supply, 10-day supply, a 20-day supply. It was nuts. Why can't we get mebendazole in? She had a valid prescription for 60 days. At no point did we ever get 60 days worth of mebendazole. So why we don't have that available to us here, I have no idea. She then went on post to try that pharmacy, and they said, "Oh, we can't get it. We have albendazole. Why don't we try that?" Okay, sure. So we got albendazole. This is essentially the anti-parasitic that she's on right now. And our sequence is going to be, so this is her. Let's see if you can see that. She's got her list here next. So here's her albendazole. She'll do this praziquantel. Hopefully I'm saying that right. I probably need to look that up, but that's what happens when I read things and I don't look at how to pronounce them. But this is from OncoStore. So I'll try and say where we got these as we go through. So from OncoStore, she was also on the Happy, Happy Healing through the fenbendazole support group. They do the Happy Healing stuff. So she was on the trio for a bit. And that had fenben and praziquantel and whatever, one more thing in there, I don't remember. But so I'll just have her on a high-ish dose. So that's going to be, I guess, 1 per day. This is, I don't remember off the top of my head, 500 milligrams. So I'm trying to keep her about 500 milligrams. So you'll see that it'll be 400 to 500 milligrams as we go through the antiparasitics. And again, that's a relatively low dose, and that's because she's not actively fighting cancer. I'm not looking to have the toxicity build up over time. We are trying to remove some of this with the activated charcoal and the serrapeptase. So we're trying to be smart about this. But you do just want to be careful about taking a ton of antiparasitics all the time, every day. I do think there's a load on the body, similar to chemo, that your body will eventually start to struggle with. After she's done with this, then she'll do itraconazole. This is another OncoStore. So this is 200 milligrams, so she'll do 400 milligrams a day. She took this already. She didn't have any issues with itraconazole. I'll probably put her on fluconazole as well. That's another candida fighting antifungal. And then she'll do fenben after that. So this is another OncoStore 500 milligram tablets. We'll probably split those in half and just do 250 a day is what we'll probably do. So that will probably take her, with these doses and this amount, this will probably take her pretty close to the end of the year. And that's, she'll be done with Lynparza in November. So that'll be grounds for another holistic review of what we're doing. Okay, aspirin low dose. So she takes, oh shoot, here, look, I didn't show you. Let me go back. Here's our activated charcoal. This is what we'd use. 1,200 milligrams, Natural Life labels. This is from Amazon. So she does one of those a day. Yeah, 1,200 milligrams. So that's 2 capsules. So she just does 1 capsule. And then we do the double wood serrapeptase. So those are from Amazon. Okay, next. Okay, let's go back. So there. Now she has struggled. She doesn't want anything with titanium dioxide. So that is an inactive ingredient in that to whiten it. There's a number of studies that I want to say got buried, but it seems to be in everything. And because it's all natural, they tend to add it for a whitening agent. She doesn't want it as a whitening agent. She doesn't know why anyone cares what color the pills are, because you're going to be swallowed anyways. But She does do this. This is considered anti-metastatic. So this is, I'll say, Paul Merrick and Jay McClellan both talked about this, in that there is a supposed relationship with essentially tumor cells that break off from the tumor, circulating tumor cells of sorts, and they stick with platelets, and that's essentially how they set up camp in other locations in either your lymphatic system or through your blood flow. So different mechanisms here. So through blood flow with platelets, some cancer cells allegedly stick in with platelets, and that's how they make it to other locations, is those platelets will stick to other parts in the body. Let's see. So yeah, she does so low dose, that's 81 milligrams. So I'm going to keep her on that for probably for quite some time. Okay, beef liver pills. Oh, did I forget those? I did, didn't I? Okay. Thanks to the chat that we had earlier, she was on grass-fed beef liver pills. She was up to 9. Now, she put herself on that. She's worried about her blood counts. So what are we trying to do? We're trying to keep her red blood cell and white blood cell counts up. They have been, I'll say, at the very least, up and down with Lynparza. And so I'm going to call this bone marrow support, in that we're trying to enable the bone marrow to stay healthy so that it can continue to produce immune system cells. So your white blood cells are your lymphocytes and your eosinophils and everything related to your immune system, right, is your white blood cells, basically. That's not true. Not everything for your immune system, but a significant portion of your immune system is created through your white blood cells and all the different types of white blood cells. And that's all through your bone marrow. So give the body what it needs. There's, I'll say, a growing camp of individuals that feel that our modern diets are devoid of basic nutrients because we as a society have stopped eating organ meat. So we're trying to essentially get nutrients naturally, and that's with eating organ meat. So this is freeze-dried supplements. So we're in the process of switching from liver to spleen. And that was at the recommendation of one of the other ladies in the tribe. So thank you for that, Teresa. With liver has a high iron content, which can help with fatigue, but this is one of those, there's no risk-free option type situations where, okay, if cancer can feed on iron, there's a potential to feed the cancer. We don't want that. And Teresa recommended trying grass-fed spleen specifically. It has lower iron, but still has nutrients. We might experiment with just ground up organ meat as well. And again, that sounds really gross, but in a supplement, like it's really not gross. So we might experiment with organ meat as well, but we're going to use up, I'll use up the beef liver stuff. We'll switch my mom to the spleen and we'll see how that goes. Go ahead and look at my video that I did on reading your labs. I do talk about this quite a bit. So I go through all of my mom's labs to show where I think the beef liver helped her. We saw, again, an improvement in her blood labs within 1 week of starting this. So I am a believer in this based off of that. And again, the important thing is to keep the immune system healthy while she's being poisoned. Okay, next is the berberine. That's your, I'll say, glucose moderator. And it does have some broccoli. So the type of brand that we use is Berbolete, and that's by Mara Labs. A friend of mine recommended this. She's vaccine injured and is very health conscious, and she knows the owners, and she recommends them. She's from Charlottesville, Virginia, so she knows these people and swears by this company. Okay, we're going to try this again because I got cut off. Apparently I need to charge my phone. But here's the Berbolete. So bioavailable berberine, and it's from the USA, made in the USA. And again, my friend swears by this company. It does have the broccoli seed complex, so that's, I'll show that in another one here in a minute. So that's the sulforaphane. Can't say that word. They do this just to make my life challenging. Okay, so that's her berberine that she takes. She does that 3 times a day. In my opinion, you can't have enough broccoli, so you'll see that that's going to be in a couple other things too. Okay, where were we? Berberine. There we go. Okay, so she's going to continue to do that breakfast, lunch, and dinner. Now we didn't. We've started to add more carbs in. We were doing more of a keto type diet. I'm not convinced that that's effective, and I know of at least one other person who was still on keto when she was diagnosed, and now I'm seeing that there's some types of fungi that essentially feed off of fatty tissue. So as far as where do I suspect high-grade serous carcinoma, I do think that it spreads into the omentum for the fatty tissue, and to me that's a clue that we're dealing with some type of pathogen that thrives on lipids, fats. So I do want to be careful of that. And this is a classic dilemma, I think, for ovarian cancer is how do you starve the cancer without starving yourself? Oh, wait, it eats carbs, it eats fats, it eats I mean, just it's an unwinnable situation unless you can, I'll say, do the Jane McClellan approach and just block everything that you can, or actively try and fight it. So I'm trying to do both here. Active duty military, I just want to kill things. I've never killed anyone, but in this case, this is your enemy and I want it gone. So that is in the back of my mind when I'm doing this. Okay. So when you look at the, I'll say the Mark Lintern approach, what I didn't necessarily give credit to earlier on was the Makis approach. And I know Makis is somewhat controversial right now, but I think there's value to the concepts. The study that he did with Paul Merrick and a few others, I think it was 2024, and they talked about scaling up the anti-parasitics, so antifungals, antibiotics, and anti-protozoan, so parasites, right? They had a mix of protocols, if you want to call them that they tailored to the staging of the cancer. So in this, I do try and do a mix of anti-protozoan, antifungal, I'll say antimicrobial, antibacterial. I don't want her on antibiotics all the time, but I do want to attack a microbiome that's toxic to my mom. Again, if we achieve, if it's, how do I say this? I'm sorry. If there is the potential for essentially a dysbiosis, right, an unhealthy mix of microbes that are contributing to or causing cancer, then I want to attack all of those. So with the Zols group, and the antiparasitics, bendazole, itraconazole, fenbendazole, mebendazole, all of those, right? Those are antifungal and or anti-protozoan. Anti-parasitic, right? Because you could have tapeworms and fenben would take care of that. But then in here you'll also see some, I'll say, antimicrobial and or antibacterial components and some antifungal supplements as well. So black seed extract to me is an antimicrobial extract. So that's the effect that we're trying to achieve. That also this particular brand, TQ4X, also comes with thymoquin, which I'm in favor of. And then what I want to see is of the Nigella sativa 60-to-1 extract. Let's see, that's about what I want to see with 125 milligrams. Sometimes you'll see lower ratios, lower percentages. So I like this one because of the percentages. So black seed extract 2Q4. That one's from Amazon, I believe. Okay, Boswellia extract. Now this was when she was in chemo, we were taking this, and this was supposed to help her white blood cells. And I do think it did help. It has some antifungal properties to it, so I'm happy with that. So this is a two birds, one stone kind of deal for me. But yeah, Boswellia to me. So we're actually going to switch that though. So if I'm going to switch her from beef liver to spleen, then I don't necessarily need white blood cell support the same way. So we're going to exchange that for the broccoli. This is another Mera Labs product. Let's see. So yeah, broccoli seed complex. So they tell you what's in it, and then here's your sulforaphane. So I'm generally happy with that. I think you can get other brands. It does need to be refrigerated, so I like that. So I'm going to try and keep this video short so I don't keep it out of the fridge too long. But that's essentially what we're switching it with. So, and then we might go back to the Boswellia here in a little bit, but that'll be later. Cod liver oil. Let's see. I'm moving right along here. Oh, here. She also does coconut oil. So we do MCT coconut oil. She does this once a day. I would say 1 to 2 tablespoons. She puts it in her yogurt, mixes it around. And boy, does that just work. So it's a healthy oil. I can't say enough good things about coconut. But yeah, this helps her stay regular every single day. You know, when we went to Florida for the conference and she wasn't taking it, boy, did she start it right back up as soon as she got back. So she's a believer. I'm happy that we started this when she was on chemo, and she did not have any of the constipation or the diarrhea. Like she didn't have that. And I attribute that to the mixture of coconut oil and probiotics when she was on Frontline. So this is just something we've continued, and I think it works. So that's why I say it. Let's see. Oh, cod liver oil. I'm out of order here. Okay, so she's on cod liver oil right now. And really what we're looking for is about the daily dose of cod liver oil. So that's about 1 gram is what I was trying to get her to do. I did have her on this Nordic Naturals kind, but it was 2 pills instead of 1 to reach 1 gram. And this one is 1 pill. So we're going with that. So we like that. This one also has a mix of some... I'll say vitamin E type, EPA, DHA, so whatever. And not enough vitamin A and vitamin D for me to be concerned in any way. But yeah, we like this brand. It doesn't have a taste to it. It's a pill, but it's 1 pill, not 2, so we like that brand. Let's see. Okay, DIM is considered an anti-hormone. That's really simplistic. So before you start doing anything with hormone anything, please do your research on that. But this is what we use for her. She's ER/PR positive, so we're trying to at least keep a lid on that. I don't know if it's effective, but this came partially from the Always Hope support group. We do get that on Amazon as well. Okay, let's see. Grapeseed extract. Oh, shoot. I left that downstairs, too. Look at me. I thought I was so organized. Okay. Okay, so we do grapeseed extract. That's from Thorn. That was recommended by Barbara O'Neill in one of her videos. And we've wavered between grapeseed extract and grapefruit seed extract. So kind of odd to me, but still kind of has the, I want to say the red grape resveratrol type feel to me. It's still, I want to say, anti-parasitic undertones in this, anti-cancer. So I just have that as AC, if you could hear me my chicken scratch there. So I just have it as generally anti-cancer. We don't take a lot. I'd say generally good. I would say still very experimental though. Okay, Graviola. So she does both the soursop liquid drops, and then she's doing the pills as well. This is another big one in the natural health community. So in my opinion, this is one of those, at the very least, it's not going to harm you. Whether or not it's effective, I'm not entirely sure. I know people who have been on it and they still have their cancer grow. But I would say probably better than not taking it. It does have a lot of nutrients in it, so at the very least, she's getting some nutrients from it. Green tea, we get those on Amazon. Green tea extract, we use this Horbach brand, and this one is, we're looking for let's see if I can get it to focus here for you before I'm not hitting. Okay, so 45% EGCG, and that's essentially the, what you want to see is the EGCG. That's your VEGF, vascular endothelial growth factor. So I did a video on that, so please check that out. But green tea extract is generally blocks a number of pathways. So that's also in Jane McClellan's book. But we want it for the anti-VEGF capabilities. And that's essentially when cancer can take root. It then starts to signal the body to grow blood vessels. That's your endothelial growth factor, your vascular endothelial, right? So we want to essentially prevent the cancer from signaling the body to grow blood vessels that would help it. And so that's supposed to target cancer cells and still leave the rest of the body intact. Okay, this is Thorne again. I do like Thorne. My naturopath uses Thorne. I generally trust them. Their subscriptions are a little annoying. They're in 30 days, which if every month had 30 days, that would be fine. But okay, well, February has 28, March is 31. I mean, it's just the subscriptions can get a little wonky. But this is the drops, which again, she puts this in her yogurt. She does 4 drops. If you're on high dose vitamin D, you want to add in K2 so your body's not storing calcium in weird places. And again, those K2 with vitamin D go well together. When you're doing high dose vitamin D, you need to have the two. And it's not a pill, so that's nice. Lion's mane, she's taking this. So she's taken a lot here. Again, her neuropathy with Lynparza has just been really bad. We were surprised at how much worse over time her quality of life has been compared to when she was on chemo. We didn't expect that. But she's taking a bunch of lion's mane, and then she'll switch back and forth with our alpha lipoic acid. That's another anti-neuropathy type. So she'll do 600 milligrams of alpha lipoic acid. Sometimes she'll do both, so she'll mix those two around. Okay, there's her Lynparza. So she was on 4 times 150 milligrams per day, but the brain fog and the neuropathy, I mean, she was unhappy. We talked to the oncologist. The oncologist was not inclined to reduce her dose. I guess her quality of life was not bad enough to be clinically significant. My mom did opt to reduce her dose anyways, and it was pretty interesting how immediate the brain fog. I wouldn't say it went away, but she dropped down to 3 pills a day, and her brain fog improved almost immediately. I mean, it was amazing. Her neuropathy is generally good. Doesn't seem to be increasing. She does have some weird symptoms with coldness in fingers where it gets cold for no reason. But in general, those were the 2 major things. And again, you look at brain fog as far as, well, how do you function as part of a family? How do you function day to day? And I mean, it was driving her nuts. She felt like she couldn't function. What's interesting about this is within, let's see, she started doing 3 a day in December. She met with her oncologist as part of her quarterly meeting in the end of January. End of February. So she'd been doing this for about 2.5 months. And the oncologist knew right away, did you reduce your dose? So looked at her labs. They never talked to her about her labs. Oh, your labs are good for where you are, and they're good. They never talked to her about her labs, but she reduces her dose, oncologist knows right away. I will note that if you can, since she's done that, her white blood cell count has gone up 4 labs in a row now. Her red blood cells are still kind of iffy, so that's why we're changing it up with the spleen, or grass-fed beef spleen supplement. So we're going to experiment a little bit and try and work on and see what that does. Yeah, pretty interesting. The other thing, too, that they don't talk about with the Lynparza that I'm comfortable with is given how her body has responded, I guess I'm just really surprised that at 2 years you just stop. Right? You just don't. I mean, isn't that traumatic for your body? I mean, I have to wonder, what is the rate of recurrence once you stop? Is that not traumatic to just cut cold turkey like that? I mean, you wouldn't stop heart meds, you wouldn't stop, antidepressants, you wouldn't stop antipsychotics, like you wouldn't stop a whole number of medications cold turkey like that. But for cancer, it's okay. And I do struggle with that. So we're trying to figure out what we want to do about that. Okay, magnesium. When you're having chemo, your electrolytes are low. So here's another Thorne brand. We do get it straight from Thorne website. We don't use Amazon. But Thorne magnesium is what we use. Oh, shoot. This does look like an Amazon thing. Maybe she is getting it from Amazon now. Okay. Let's see. So this is magnesium citrate. I know there are a number of different types of magnesium. I can't say that I'm well versed in the different types of magnesium. So if anybody wants to chime in and help me and help everyone else with the different types of magnesium, this is what she's doing. So she's doing about 400 milligrams each day. And she also takes an electrolyte drink as well that's low in sugar and generally tastes okay. It's pretty expensive too. But okay, melatonin, she does this. She does 180 milligrams. Oh, shoot. Did I have the wrong one? Yeah, times 3. Yeah, so she's got another one of these that's 60 milligrams. Yeah, so she's trying to use up. I think she got the wrong kind, so she has times 3 on there. So she's doing 60 milligrams, and she'll do 180 milligrams a day. That's another one of those anti-metastatic type blocking pathways, things that Jane McClellan talks about. Paul Merrick talks about that. And I don't recall if Lynparza talks about that. But to me, you can't have enough melatonin. She gets this from Fullscript, I think. So she has a naturopathic nurse that she gets Fullscript discounts from, and she's good with that. Milk thistle, this is liver support. So this is also part of detox. So as you have binders like activated charcoal and serrapeptase, you also want to support the liver to filter them out and then process them through the stomach and into the digestive tract. So this is the milk thistle that we use. This is on Amazon. I want to say nothing special about that. She takes, again, with everything she's taking, she's got 1 per meal. So you see breakfast, lunch, and dinner. Breakfast, lunch, and dinner. So, okay. I do want to point out oil of oregano. So not oregano oil. There is a difference, and it's based off of what type of plant or like what part of the plant they use. So we use this Designs for Health oil of oregano. And this is another antimicrobial, I'll say, type function is what we're looking for. And I'm going to switch her up with one of these days, dipyrimidal. I'm losing it. You say that for me. Of course, we spelled it wrong too, so that doesn't help. Dipyridamol. Why is that so hard? Okay, so I'll switch her up with that. She was on doxycycline for a little bit. So again, this is one of those things where we just, okay, when she's done with doxycycline, then she goes back to the oil of oregano. So this is from OncoStore again. You can see anything that's like wrapped like this, that's an OncoStore type thing. I know it's weird for anyone that hasn't ordered from OncoStore, but they've been relatively painless for me once I kind of got used to it. But yeah, the first order or two was challenging for me. Okay, papaya extract, that's for platelets. We do Herbal Goodness papaya leaf extract. This is from Amazon. She does this. Her platelets are, I would say, holding steady, so we don't have any concern right now. We're going to keep the papaya leaf extract. Parsley, that was a white blood cell support. When she was on chemo, we've just kind of kept it. It's also antifungal for some types of fungi. So to me, again, 2 birds, 1 stone. We have reduced it. It was a breakfast, lunch, and dinner. She's now twice a day. And we just kind of keep up with it. Parsley is another one of those type, was it like a chelator? Like parsley and cilantro are essentially same family. So I think you can't get enough cilantro. You can't get enough parsley. I just think the world of those 2 herbs. And I love cooking with them too. Okay. Palo d'Arco. This is another, I'll say anti-cancer generically, highly spoken of in some of the really like natural and holistic health circles for cancer. So she uses this. And then I'm going to switch her up. My friend recommended this as a lymphatic drainage. So this has a number of herbs in it. So this is, again, she'll throw a milliliter of this into her yogurt. And but dandelion, burdock, red clover, I mean, just tons of, I'll say, generally good stuff to have for immune support. So we're going to do that. And then we'll switch back to Paldarco when she's done. Potassium chloride. She gets terrible leg cramps. So that's part of the push for the electrolytes. So she's on prescription potassium. Let's see. Actually, that's downstairs too. Okay. Well, it's prescription. Nope, here it is. It's over here. See? So these big old pills. Golly. And she asked, well, they asked if she had different doses. She said, no, well, you can cut them in half. Well, then you have this like jagged edge going down your throat. So here's her potassium. But yeah, to get non-prescription, it was like 10 little pills a day. It was driving her nuts. So she got the prescription for that. Okay, probiotic. We're on this one right now. We do rotate probiotics. We're looking for essentially different types of bacteria. This goes in line with, okay, well, she's going to be on antibiotic type medications. We do want to make sure we off-cycle antibiotics with a probiotic and prebiotic. So she'll do this on occasion. Again, you want to look at the different types of strains, essentially write them down and see if you're missing any. This Therabiotic brand, these are both available on Amazon, but Therabiotic is cool because it's refrigerated. So they even mail it in like a cold pack that stays cold. I want to say like dry ice type cold pack that's frozen. And then, so at least from the, hey, did the bacteria survive in transit? Generally, yes. And it does have, again, a number of different types. So I appreciate that they list them out. That means they've tested it, I hope. But this one is pretty expensive, so we switch it on and switch it off. We don't do it all the time. Okay, quercetin. Boy, this is another word that I struggled with in the beginning, but I had to look it up 3 times just to get... I wanted to call it quercetin. Maybe that's because I lived in Alabama for so long that you just want to elongate some vowels. Quercetin phytosome, you know, you can say it in that accent. And this one has some bromelain in there. But I think, did I miss that? Yeah, so graviola, we're going to switch with bromelain. So I just found one on Amazon that I liked, and so we'll switch that when she runs out. This has a little bit of bromelain. So sulforaphane and bromelain to me are two of the compounds, anti-cancer. You can't get enough of those in my opinion. So this is another example of that. So that's why it's a complex, and then they can charge you extra for having, you know, a mix of things in there, but whatevs. Okay, there's our quercetin. Oh, there's the lipoic acid. Okay, so okay, she does do Tudka. That's another liver support. This is the brand that we use. We get it on Amazon. I'm actually going to pause her on that. Her liver labs are fine. So she's getting a lot of liver support between the milk thistle and the serapeptine. I mean, everything is fine. So she's almost done with this. We're going to skip that and pause on that. Again. And let's see, vitamin D. Here's the fun part about vitamin D is I've had her on a mix of things. In my opinion, cancer patients need to have vitamin D levels above 90. Above 90. So when she started, she was in the 40s. I had her on, here's Thorn, again, 5,000. I had her on 15,000 IU per day. And it took 6 months for her vitamin D levels to get up to 105. And this is one of those things where don't freak out. Oh gosh, I'm above limits. No, it's vitamin D. Like nobody dies of vitamin D overload. Yes, you can Google it. One person apparently died with like a 400, normal range for vitamin D is 30 to 100. This person had like 400 or something. So yes, one person supposedly died, but for cancer patients, the research, and this is Paul Merrick coming into my mind, the research says you want high vitamin D levels, not normal, not like, not 30, not 35, you want high. So that's why we took drastic steps. 15,000 IU is a lot, but we wanted immediate improvement, and it took 6 months to get it high enough. I reduced her down to 5,000, got it tested again, and it went up to 126. So I was like, oh gosh, okay. So brought her down to 1,000. So now she was on 1,000 for a little while, and that got tested again. It was down to the 70s. So shoot, okay, so we need less than 5,000, more than 1,000. She was doing 2,000 for a little bit. So we're still playing around with that, but the sweet spot for her is between 1 and 5,000. And I feel comfortable now that she's been on 5,000 and she's been on 1,000. Okay, she gets up to 120. Who cares? Just ease back and go and lower it and switch your dose again. So it's not a big deal, and there's no reason to freak out. But this is an important part, in my opinion, of immune system function, and that's your vitamin D levels. Again, if you're going to do high dose vitamin D, you need vitamin K2 with it. Okay, and she likes to take zinc just because. So it's supposedly good for you. I don't have any reason not to, but she takes it, so that's what she does. Okay, let's see. Other honorable mention, loratadine. That's another anti-cancer niclosamide. So I've switched out niclosamide with Fenben and mebendazole and ivermectin and all that. She's not taking that right now, but I have some. Where do I have that? Niclosamide. Here it is. Okay, so here's another OncoStore. So this one is in the hopper, and again, this is probably going to go in the rotation when we're done with this other list of things. Let's see. Here's some more of her mebendazole, again, because we couldn't get mebendazole here. She had a prescription, couldn't get it here, but OncoStore has it, and it's really cheap, so why not? Here's our ivermectin. So we'll do that when, again, that'll go into the rotation. Now, here's one that I really wanted to try, and this is incredibly experimental, but voriconazole was listed on OncoStore's site as being for essentially internal fungal infections. So this is high dose. There's only 8 pills in this, and these 2 boxes were $300, again, on OncoStore. But I'm keeping this this will go in the rotation probably after she comes off Lynparza. Again, if it's for internal fungal infections, I expect it to be a little bit more potent, a little more toxic. So I'm hesitant to do that with Lynparza right now. Okay, and then she does snoot. So this is chlorine dioxide. We got this at the Children's Health Defense Conference, and basically you would mix these 2 substances and have a nose spray. She gets a sinus infection on occasion. She'll get a cyst in her sinuses, so she can have some discomfort there. And I would trust this during flu season as well. So, hey, you think you're exposed to someone, a couple squirts of snoot in the nose, and it's essentially protective. So that's how we use this. Again, use this at your own risk. Please do your own research. And then last but not least, I probably should have said this first, but how do you do this safely? This is my opinion. So take this or leave it, and please do your own research. But there are tons of drug interactions websites. So go and Google it, and there's WebMD and this and that. So what I will do, my procedure is I type these in to the drug interactions website. We send this to her oncology pharmacist. Her oncology pharmacist is light years ahead of her oncologist and actually cares about talking to her about supplements and things like that. So we love her, and so hopefully if you don't have an onco pharmacist that you trust, you can try and find one, but they do exist. If you're concerned about doses, always think about titrating up and down. So titrate, right? Slowly increase or slowly decrease depending on how you feel. And that could be 1 pill every day, that could be 1 pill every other day, and then 2 pills, and then 3 pills. So whatever your chosen dosage is in accordance with what you're trying to achieve, consider titrating up and down and one at a time, so you can monitor how these things will affect you in an aggregate sense. So starting all of these at once, if you respond poorly, you're going to have no idea where to start. So think about doing this one at a time. And then monitor your labs. So I did a video on monitoring labs and what I look for my mom. So please take a look at that for some ideas of things you can do and things that might affect you one way or another. Okay, so that is it, I believe. So this is Mom's Lynparza thing. This is, we sat down today and we went through, this is what she was doing. These are some changes we're going to make going forward. And then she has a schedule basically of how she's going to, what the rotation's going to be. So, so that's that. Love you ladies. And I hope you have a great Easter weekend. And I wish you luck in your protocols and achieving your health goals. Bye everyone.